Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast. What's up, Everything Medicare Podcast Nation? Happy Wednesday. Welcome to another episode and another edition of the Everything Medicare Podcast. Every single week, I bring you 3 episodes of the Everything Medicare Podcast where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. If you don't know who I am, my name is Christian Brindle, and I own a company called Christian Brindle Insurance Services where we work with people on Medicare just like you in all different situations in various different places, and we partner with many multiple different insurance companies to help sort through options for folks to find them the best available fit based on their specific needs and preferences, whether it be Medicare supplements, Medicare Advantage plans, Medicare Part D prescription drug plans. And we are in October, folks. October is the month where open enrollment for people on Medicare begins. Technically, folks, open enrollment does not really begin until October 15th, but I have always said that you should really look at open enrollment as beginning on October 1st. Let me explain. October 1st is the day that all of the changes for Medicare Advantage plans and Medicare Part D prescription drug plans are made public. They're made public for you to see, the consumer, on what your plan is going to look like next year and or if there's going to be a better program for you the next upcoming year. So October 1st is when you can really start making preparations on what you might want to do on your particular Medicare plan. But it's also when you're going to start receiving advertisements, things in the mail, TV commercials, internet advertisements, possibly people calling. And it's always a good idea to be prepared on what you need to know and what you need to look for. But I know that if you're listening to this podcast, that you're somebody that is going to be prepared and is going to make a good decision because you care about educating yourself on what your choices are and what you should be doing. Today, folks, I want to talk about something that is an age-old question, and that is, what is the better thing to prioritize when it comes to picking your Medicare health plan? And what I'm talking about today really has more to do with Medicare Advantage plans than it would Medicare the Medicare supplement plans or Medigap plans. Because Medicare supplement plans and Medigap plans, primarily speaking, have the same benefits across the board. The only difference you're ever going to see with a Medicare supplement or Medigap program is, simply put, the prices. And the price increases from year to year. The benefits are standardized. We know this about Medicare supplement Medigap plans. So, we're really more talking about Medicare Advantage, and that's kind of what I had in mind to talk about on this episode anyway. So, what are we talking about today? Benefits versus convenience and service. Let me explain. Am I saying that you shouldn't want good benefits on your plan? Of course I'm not saying that. Please don't misinterpret my message on this episode. Please understand what I'm trying to say. I see so often people on Medicare put themselves in a situation where they're prioritizing programs specifically based on which one has the fanciest benefits, which one has the most dental coverage, which one has the lowest copay here or lowest copay there. And don't get me wrong, those things are important and those things matter. Those are things you want to prioritize on your plan, but sometimes they do it at the expense of working with a quality carrier. And I don't care what anybody says. I don't give a damn. If you've listened to me for some time, you know I just don't care. I speak my mind, I say how I feel, and I primarily do so because it's what you need to hear. It's information you need to know, even if the rest of the insurance industry doesn't want you to know it. I don't care. I'm in this to put the power in your hands. Because not many other people are willing to do that, put the power in your hands. Usually, people have an agenda. And the people that have an agenda don't tell you the full story. That's what I've found. So let's get into what I'm talking about in here. I'm going to tell you a story. And if you've listened to me for some time, you know I like to tell stories to kind of get my point across. I'm going to tell you a story, and we're going to call these two people Jack and James. First things first, we'll talk about Jack. And granted, you know, I've seen this situation happen a million different times over the years. The names and the faces change, but the story always remains the same. And that is this, folks. Let's start talking about Jack. Jack is somebody that's on a plan that for the last 5 years in his particular market where he lives, he likes the Medicare Advantage plans. He's established that in his eyes, a Medicare Advantage plan is going to be the best plan for him going forward. It's the best option for him. He likes everything that it comes with. However, Jack also likes to shop the market. He signs up for a plan that he keeps for a 5-year period. And over that 5-year period, the plan he has is incredibly consistent with how it keeps the benefits relatively level and the same. Not to mention that, this program, this Medicare Advantage plan that Jack has an incredibly large hospital and doctor network. If you've ever talked to anybody or you've ever heard a story, a horror story as I like to call them, about Medicare Advantage plans, it is people not being able to stick in the network. People go somewhere and they don't realize that they're out of network. You've heard this before. The plan won't pay for anything. If it's a PPO, they'd pay something out of network, but typically with an HMO, it's a hard network. You don't have the flexibility of going out of network. But what people that tell you these horror stories do not tell you, they fail to admit, is there are plenty of Medicare Advantage plans that have enormous networks that give you tremendous amounts of options. And as long as someone's checking your doctors and your providers and determine that all of your doctors and providers are in that plan's particular network before you consider enrolling into that plan, the network isn't an issue. And you also need to be aware that if you go to a new doctor by chance, it's important to check to make sure that that doctor is in the network. That's how you avoid going out of network and not getting coverage. But these people were never told that. As long as someone's aware of that and the network fits, the network thing is a non-issue as far as I'm concerned. And having a plan with a bigger network opposed to a plan with a smaller network is always going to be in someone's favor, in my personal opinion. More choices means more options. More options means more flexibility for you to do what you want to do. There may be 3 or 4 different hospital systems in your market where you may live. But in your market, these different hospital systems might have different strengths and weaknesses. One of them might have incredible care for cancer treatment. Probably want to have them in your network. My market in Utah does. We have a hospital center called Huntsman Cancer Research Facility. It's one of the best in the country. When I lived in Florida and Tampa, there was a facility there called Moffitt Cancer Center. That's a system that people in that area want to have in their network. But it's not just that. You might have a facility that has incredibly good rehabilitation programs. You might want to have them in their network. And so on and so forth. So Jack has a plan that's been relatively consistent in benefits. It doesn't go up and down much. It's relatively stable from year to year when it changes. Has a big network, always has. But Jack is a shopper. Jack likes to shop around for the newest, shiniest toy, if you will. Jack comes across a plan that has been relatively inconsistent from year to year. Or, better yet, it might be newer to the market. Let's say it's just came in that year, for the sake of example. Jack notices that a few of the copays are lower. His current plan, let's say for the sake of example, has a $5 primary care doctor visit, but on this other plan it's $0. Might have a $45 specialist visit on his current plan, but this other plan is $40. This other plan also might have better dental than his current plan. Sounds pretty good, right? Jack enrolls in the plan. Without knowing too much about the insurance company, it's someone that he isn't particularly familiar with, or let's say it's a company that he knows has a bad reputation from people that he's heard about it from, but he does it anyway. Says, better benefits, better on paper. Come to find out, this new plan that Jack's enrolled into has a referral program. Now Jack can't see any of his specialists without a referral from his primary care physician. Guess what? His primary care physician is not willing to write the referral. He doesn't think it's necessary for Jack. Jack's frustrated. Jack tries to use these fancy-dancy dental benefits. The insurance company signed up with is incredibly difficult. They fight every single claim. These companies are out there, folks. On top of all that, Jack finds out that he has a network a quarter of the size of the plan that he used to have. All to save a few bucks in a copay. Was it worth it for Jack? Or would have Jack been better off with the company with a better reputation, even if it meant slightly worse benefits? I'm not telling you what the answer is. That's up to you. If it was me, I would rather have less hassle. I like things easy, folks. I don't like hassle. I don't like stress. I don't like fighting with things. And that's my philosophy with insurance companies as well. I think working with a good insurance company is priceless. Working with a company that has great customer service is priceless. And it's not worth it to do the dance with an incredibly difficult insurance company that has an incredibly bad reputation just to save a few dollars on a copay or maybe have $100, $200 more on a dental benefit. Of course, you may disagree with me on that, and that's okay. I've done plans for people that I didn't think were the best thing for them, that I thought would be difficult insurance companies for them, but they insisted that's what they want. And at the end of the day, folks, I'm here to give you my opinion. But at the end of the day, you make the choice on what plan you want to go with. Stay with me into segment 2, and we will talk about the other person in this scenario. Don't go anywhere after a message from this week's sponsor, Randy W. Hall, the Mr. Nice Guy Medicare Advisor. Stick with me.
What's up, everybody? This is actually Randy W. Hall, Mr. Nice Guy Medicare Advisor, not Christian Brindle, your esteemed host. I'm here to tell you about my Medicare agency, Mr. Nice Guy Medicare Advisor, based here in Tennessee. For the past 10 years, I've been helping Medicare beneficiaries just like you in Tennessee and Kentucky maximize their Medicare. If you're a regular listener of this podcast, you know Christian always encourages you to deal with a broker in your state who sells all the different plans and will give you not just a quote, but also advise you and educate you in a way that is simple to understand. We know how confusing and overwhelming the whole process can be. We do it all for folks on Medicare, from supplements to Advantage plans, Part D, cancer products, hospital indemnities, and more. So if you want to get a free quote or a consultation, I urge you to call 615-578-5174. Again, that's area code 615-578-5174. Or for more information, you can visit my website and read all about me at MrNiceGuyMedicareAdvisor.com. That's all one word, MrNiceGuyMedicareAdvisor.com. And again, why deal with a jerk when you can deal with a nice guy?
Welcome back, Everything Medicare Podcast Nation. I sincerely hope you enjoyed that message from Randy W. Hall, the Mr. Nice Guy Medicare Advisor. If you live in the states of Tennessee or Kentucky, I recommend giving Randy a call because First things first, Randy's a Medicare expert. I always recommend that. But sad to say, my organization is not licensed there. But Randy's is. And I encourage you to give him a call if you feel like you need help with your Medicare health plan. So let's get back into this. So in segment 1, I gave an example for Jack, okay? The second person in my example, I think I said his name was James. Forgive me if I'm wrong. Don't blast me in the comment section on YouTube if I'm wrong on that. If you're watching this on video, that is, on YouTube. So I would say the second person is James. James understands what he has on his Medicare Advantage plan. Let's say he has the same plan as Jack did originally. The consistent plan that's been consistent year after year, has a humongous network, easy to deal with, no referral program. James gets presented with the same exact plan that Jack switched to that he ended up having so much trouble with. But James has heard whispers about this company. James does some research about this insurance company. Doesn't like what he finds. James elects to stick with his current plan because he'd rather have the convenience of good service and easy company to deal with than a couple bucks extra benefits. And that's what I would recommend. It's not just benefits. Don't get me wrong, you want great benefits. Benefits are important. Benefits are great. But if you have to fight to get them, what are they? They're more worthless than anything else. If you have to expel a tremendous amount of stress and time to get the insurance company to pay out these benefits or give you what you think it's going to give you, the benefits are about as valuable as a match that's been dipped in water, because the difficulty that the insurance company provides is the water, and it makes the benefit utterly useless, folks. I'm not saying every insurance company is like that, and there's probably more insurance companies out there that will provide the benefits at not much difficulty than there are the difficult companies, but they are out there, and you need to be able to watch for them, and you need to be aware of them going into this Medicare enrollment period. We are getting close to the 15th of October. That is the first day you can officially make a change on your Medicare Advantage plan going into the new year. I encourage you. You want to make sure that you're getting the best benefits you can possibly get. I understand, I agree that it's incredibly important. But not if it's going to mean giving up convenience, comfort, good service, easy to deal with. You want a combination of both. Not all benefits but difficult company, and not all good company to work with but crappy benefits. You need a mixture of both. And that's my message. That's what I preach. Make sure that you're taking everything into consideration, especially with a program like a Medicare Advantage plan, folks. A Medicare Advantage plan has a tremendous amount of working parts. If this is your first time listening to me, Medicare Advantage plans include your medical coverage, your prescription coverage. A lot of them come with some kind of dental, vision, and hearing coverage, although some are better than others on that category. They have networks of hospitals and doctors that you have to stay in network. Like I said in segment 1, it's really not an issue. It's a non-issue if you do your homework ahead of time and you have understanding on what that network is on that plan you're enrolling into. But you need to know all these things. You need to know if there's more prior authorizations than less. You need to know these things, folks. You need to know them. And convenience is important. Great service is important. If you call that company, are you going to be on hold for an hour? Are you going to get some bonehead on the phone that doesn't even know your plan exists and that argues with you that plan even exists in your state even though you're on it and you know you're on it? Are you going to get some bonehead that transfers you around to every department in the company before they can actually get help, if you get help at all? Is that worth it to save a few bucks in benefits? You want to find a plan with great benefits, but you also want to find a plan that has a good reputation and great service. You want to find the best mixture of the two. If you can find the best benefits available while having it with a great company, then you just hit a slam dunk. You just hit a home run. But sometimes you have to have a mixture of the two. It just depends on your market and where you live. Keep this in mind. I really hope this resonates with you. I have more to say about this in segment 3. Don't go anywhere after a quick word from this week's sponsor, and I'll give you my final thoughts on this topic in segment 3. Don't go anywhere. Welcome back, everybody. Thank you so much for sticking with us all the way to our third and final segment. I hope you got something out of this. I encourage you to be a James, not a Jack. James is the person that looked at everything before he just jumped ship. And James is a person that also understood what he had. I'm not saying you should or should not change your plan. It depends on what you're on. You could be doing better. But you could also put yourself in a situation where you're getting in bed with an insurance company that's going to cause you nothing but heartache and trouble. That's what you need to avoid. And you don't want to do that just to save a few bucks on copays and have maybe 1 or 2 extra benefits. You always want to be working with a great insurance company no matter what. And you can do that while still getting great benefits. Just make sure you know what to look for. And I hope this helped you find that, folks. I hope this gave you some idea of what you want to be looking for. As always, folks, thank you so much for listening. We are now able to do plans for people in Texas. We got so many requests on it, so I'm so excited to let you know and announce that. So now we can do plans for people in the states of Utah, Florida, Idaho, Oregon, and Texas. Again, that is Utah, Florida, Idaho, Oregon, and Texas. Those are our 5 states now. We represent all of the major insurance companies in all of those states for Medicare supplement plans, Medicare Advantage plans, Medicare Part D plans. We'd love to be able to help you if you feel like you could use some assistance. Our office number is 801-255-5340, 801-255-5340. I'd love to talk with you. If you feel like you need help on your Medicare plan, or you just want to make sure you're in the best spot going into next year for 2020, I'd love to be able to talk with you. If nothing else, you can find solace in knowing that you're on the best plan and at least you checked it out. We have integrity, we'll tell you. I appreciate everybody so much for listening. Thank you so much for all of your support. I am exhausted. I'm not going to lie, folks. I'm tremendously exhausted. Week 1, worked over 100 hours to make sure we brought you content, but also made sure that I was taking care of all my clients. There's a tremendous demand for my services because there's so few people that provide it like I do and we do here at Christian Brindle Insurance Services. So I appreciate all of your support during this trying time. I'm not getting to spend very much time with my wife and my 5-month-old daughter now. And it's not something I tremendously enjoy, but I love what I do. It's sweet and sour at the same time. Because I love what I do. I love bringing you information. I love bringing you content. I love working with my clients, and I love working with insurance. I'm just an insurance nerd like that. But it's tough this time of the year, especially now that I'm a father. This is my first enrollment period as a father. But I have a commitment to my clients, to my organization, to my company, and to this audience and this platform and this podcast. Don't get me wrong, I'm spending time with my daughter every night when I come home, but it's just not as much time as I'd like it to be. But I'm there for you. I'm there for you, and I appreciate all your support. We want to make this the most successful and profitable enrollment period for you when it comes to getting the most out of your Medicare as we possibly can. And we're going to do it. And thank you for investing in your own education to making the best decision possible. Have a great day, and I'll be back with another episode on Saturday. Talk soon.